Hi, good morning, good afternoon. My name is James Gillespie and I'm a Research Associate in Wearable Technologies at Ulster University. It's my pleasure to be attending the Arctic Frontiers Conference here today in order to highlight one of the deliverables from the research project which I work on called Smart Sensor Devices for Rehabilitation and Connected Health, otherwise known as SENDoc. SENDoc is an Interreg NPA funded project. It was funded in 2017 and is running until June this year. And the deliverable research that I want to highlight at the conference today is entitled A Transnational Home-Based Rehabilitation Service Delivery Model. The team who worked on this are interdisciplinary, so we have myself, Joan Condell, Daniel Kelly and Carla Menzo Esquivel, all from Ulster University and a computer science background. Antti Alamäki from the Karelia University of Applied Sciences in Finland, and he's a physiotherapist. John Barton from the Tyndall National Institute at University College Cork, an engineer, and Anna Nordström from Umeå University in Sweden, a clinician. The transnational home-based service delivery model which we have developed is an infographic model which maps how prevention and monitoring sensor technology can be incorporated, added to and supplement the current clinic-based rehabilitation model which currently exists, and then how technology can be used going forward as a tool in the rehabilitation process. Really what we've looked at doing is how we can change this clinic-based traditional rehabilitation model into a telehealth model. Creating a telehealth model for rehabilitation is vital so that we can connect patients in rural and sparse communities to the specialists that they need. We know that the people who are most likely to need therapy are elderly patients, and it can be an arduous task for them to travel long distances to the clinic. So what we've looked at is how we can use technology in this situation in order to connect the therapist to the patient while the patient still gets the same level of care that they would in the clinic. The model we have produced captures how technology can be used as both a preventative tool by encouraging preemptive actions in self-care, for example, using an activity tracker to encourage exercise and therefore hopefully mitigate the need for therapy, and also how technology can be used at the diagnosis stage and also the rehabilitation stage. Our model means that patients can be connected to the relevant experts regardless of their location. No longer will people living in remote and rural communities be disadvantaged by not having the correct access to care that they deserve and need. Our model is especially relevant in 2020 and 2021 as the COVID-19 pandemic continues to spread worldwide. It's not just rural communities who now need access to remote therapy, as we're all being encouraged to stay at home and reduce our social contacts. Experts using the correct sensors and technology can continue to provide the same level of care they were at the clinic remotely using our model.